so awesome. So basically, okay, what we're completing now is a self-care assessment. What do we need to get better at practicing self-care and loving ourselves, putting ourselves first, all that good stuff. So the first one would be physical care, right? Eating healthy, exercising, taking care of our hygiene, wearing clothes that we feel good about ourselves with, eating regularly, sleeping, then obviously checking up with our doctors, primary care, blood work, all that good stuff as well. Then resting when we're sick. Sometimes when we're sick, we just want to go to work and keep going. And then basically taking care of our overall physical health, okay? We're ranking it as, you guys can see it, 1, 2, 3. 1 being I don't do it well, 2 being I do it okay, and then 3 meaning I'm doing it well. Then we have a part of a star, kind of like a column of a star, where you can mark it. Even though you think you're doing great and you're doing enough of it, you might want to get better or do more. And the other aspect we have here in our self-care assessment is like psychological and emotional self-care, which is basically the one I'll be discussing more today. It's more like participating in hobbies, just like what we do here in FFAP, finding reasons to laugh, talking about our problems with someone, getting away from distractions like social media, emails, all that stuff, learning new things like languages, hobbies, instruments, then obviously recognizing my own strengths and achievements. Sometimes we're doing amazing things, just like Christina, for example, doing it here, and we think it's bragging when we talk about it, but it's actually just recognizing our achievements. Then we also have an aspect of social self-care, which is spending time with people who you like spending time with, meeting new people, having stimulating or debating conversations with people, keeping in touch with old friends, then spending time alone sometimes if you have a romantic partner, with that romantic partner, and asking others for help when you need it. And in the spiritual self-care, which I was telling the girls, I practice a lot of that in my practice, so I kind of wanted to include it as well. So spending time with nature, meditating, prayer, just recognizing that things have meaning in our lives, setting aside some time for daily reflections and thinking about our day, and then participating in something that is important to us. Then in the professional self-care assessment, we have basically improving in our professional skills, like in whatever we do, just keep getting better. Taking breaks during our work, saying no when we don't feel comfortable doing too many responsibilities, or setting boundaries. Learn new things from my profession or your profession, maintaining a balance between professional and personal life, and then advocating for ourselves at work. That's very important. Sometimes we don't do that enough, especially when we know we deserve it. So everything kind of ties up together, and just evaluate like 1, 2, and 3, and things you need to be improving on.
And tell me a little bit about you.
Oh, see, I'm gonna do that in the presentation. Okay. So you wanted me to talk about myself, but I'm gonna do it later.
Thank you.
Thank you for doing the exercise. Está bien, mi amor. I'm not gonna put you on the spot, but it's more for self, kind of like you to do your own assessment. Está bien, and see where we need to get better at it. I am, and this is not, I'm not lying. I usually do this exercise, or one that is a little bit shorter, at least once every 2 months. Mm-hmm. And it's more because I am far from my family. Mm-hmm. So there's a lot of my business, and then I do like 6 different things. I know Malini has her, like I go here and there. So I usually do it porque it kind of, I use it more as a grounding as well. Like, okay, espérate, this is a chaos. What do I need to work on? And it helps me because I'm very kind of OCD of having lists. Okay, I want to work on this one the next week, then on the other one. So it's a very helpful exercise. Anyway, let's get to it. I promise it's going to be super quick, 20 slides, but don't make me bored up here. También interrupt me. También. So, very quickly, just in case you guys, and I again, maybe you guys know what a psychiatrist is versus a therapist or a counselor. So the MD and the FAPA means that I'm a psychiatrist. ¿Está bien? And the FAPA is more like I'm a fellow of an American Psychiatric Association, which means I'm board certified, and I got this exam, and I have to pay for the other one. I have a lot of debts because of it. But that's what it means. The other type of specialty, that is more, that I'm going to talk a little bit about today, is more like counseling, therapy. Those are going to be more PhD, LCSW, and all that sort of thing. Okay, so the training is a little bit different. I had to go to medical school, and after medical school, do 4.5 years of psychiatry. I did an extra year to do more therapy, to be able to do psychotherapy as well, and then an extra year just in like a training for children.
Oh, that's
So,
good.
I know, I love that.
So basically, like, you can diagnose people, and because counselors can't diagnose.
Correct.
So
So,
that would
I do
be
more
more-
diagnosing and medication management. I mean, sorry. Most of the time, my work looks like I have a team of counselors. Like, let me just talk to you about this particular job that I love here. So I see kiddos that are all Hispanic, ¿verdad? And children, adolescent, non-documented Hispanics. And the counselors see them and they're like, okay, we need a diagnosis to keep doing counseling. I see them for diagnosis, and then after that, 3 months more of therapy, and then I see them again for medication. I mean, I don't like medicating kids, that's why it takes that long. But if they usually, if you see a therapist, like Christina said, just more for talking, coping skills, that sort of thing. And then myself, personally, more like a psychiatrist, more for medication and diagnosis. I also do therapy just because I like it. Have you?
Okay.
Anyway, quickly, super quick disclaimer. If I give advice here, don't sue me. Basically, that's what I'm saying. I'm technically not supposed to, because you guys are not my patient. I technically can, so hypothetically speaking. Okay. Very quickly. When you guys hear mental health, what do you guys think of?
Chemically imbalanced or
Okay, I put that picture on purpose for that. Than anything else that comes up with mental health.
Like how we take care of ourselves.
Beautiful.
Yeah.
Okay. Anything else? No? Okay, I want to keep on. So, well-being, I have some just random ones, right? Well-being, handling stress,
Definitely handling
making
stress.
choices, coping with life situations, behavior, feelings, self-image, thinking, facing daily activities, and then relationships, okay? That's just some of the things that kind of like associate with mental health, okay? I try to do this slide just to explain to you guys that if we see mental health as a continuum, kind of like a spectrum, it's easier to understand. Because then this, if anything, and I don't know if Christina was aware, but I want to decrease the mental health stigma a lot. Okay, so my presentation is going to be just reframing how we look at mental health. So for example, if here I do like mental illness, that's in the spectrum, which means I have good mental health, right? Like, I bet we all are, but we can fluctuate from here and there. If we have a situation like relationship ends, someone that a loved one dies, our mental health, that could be categorized by mental health problems. And we can bounce back, coming to FFAP classes, going to the club, whatever. We can bounce back mental health. Okay? The issue is when we have mental health problems and we don't do anything about it, don't do self-care, we might just eventually have to see Dr. Diaz, okay, in a mental illness. So what I want is to us to avoid, like, just bounce back. I mean, just like with self-care and everything that we talked about earlier, okay? So some of the problems, right, typical that would be categorized not as an illness, okay, but as a problem. Most typical are relationship ending, like I said, death of someone, family conflict, finance issues, and then stress at home, stress at work, or situations that we're not planning for, okay? But those are not illnesses, those are just like regular mental health problems, okay? So an illness, that's why when we get to that last bit of the spectrum, would be a medical condition, would be something that basically a professional has to diagnose. A professional very likely has to treat it too, either with counseling or medication. And it's all something that, again, a problem affects all of that, but it's to the point that it's affecting functionality. That's the main purpose. For example, I'm putting you on the spot and I'm sorry.
No,
But you're very overwhelmed with work, but I'm still able to function at work. Then necessarily it's not an illness. It could be a mental health problem. We could see a counselor. We can work on the self-care, but we don't necessarily have a diagnosis. ¿Está bien? So that's I want you guys to understand that, porque usually this is where the stigma comes in. ¿Está bien? A mental illness most of the time is caused by either genetics, because usually depression is like 36% genetics. Bipolar is almost 40%. If a family member had it, you're gonna have it. Schizophrenia is like 21 to 22%. So it's the same thing with substance use. So most of the time it's genetics. Environmental is the spectrum in the last slide. When we have that mental health problem or situation, and then we isolate, then the environment changes because I had to move to Canada. And then, all of that aspect could also lead to a mental illness. And then the last one is social influences. I put that there, and that's just more because
and I'm gonna talk about myself. I mean, very freely. So in my case, there's family history, genetics of depression and anxiety, a lot in my family. The environmental aspect, I'm pretty good environment, I manage my stuff, but then the social influence was the big one. That's why I ended up here. I moved to the United States, not knowing well the language, not knowing anybody, and then all that kind of like isolation, which we were talking about earlier, affected me to the point that I just like developed a mental illness, and I had to see a counselor, and all that stuff, which I still see her, but so it's basically developed because of a social influences, okay?
What's the instance where you don't have genetics or environmental and it's just social influences? Like what would that look like?
So that we call that, and I hate that I'm calling it a disorder, but it's like an adjustment period. Okay? So usually, let's say you would, perfect example, I moved to Atlanta, I don't know, 2 months ago, and I'm exhibiting all the symptoms of depression. It's called like an adjustment disorder until it's 6 months after the event. So for example, that's why I started seeing a counselor to avoid actually getting the depressive disorder. And we can talk more because that would just be social influences affecting and presenting all those symptoms of depression. But it's still an adjustment.
Yeah, I ask because I've come in contact with a lot of people who have, suffer from depression now. I guess because they put a time period on it, like you said. Like, if I'm depressed for a week, it's not considered like a mental illness or disorder. But if you go past certain time frame, but it doesn't run in the family, it's not environmental, there's no move. I guess it's just isolation and feeling whatever it is.
Correct. And I'm going to talk about the warning signs because anybody can develop these disorders if we basically have those warning signs. The issue, and I go back to the timeline because I hate it, we basically practice as psychiatrists for diagnosis with the DSM-5. Not sure if you guys have heard that book. Stupid book. I don't know why we're still, but it wants to put everyone in a little box. So if you have depressive symptoms, even though you're having extreme depressive symptoms, it's only a week or two, that's nothing. It's gonna wear off, which is not. It's not gonna go away. You have to do something about it. But the DSM-5 tells us it's not a diagnosis until it's like a month of it. So sometimes I get patients, kiddos, which a month of all of this to the point that they're suicidal.
They might not last, right?
Oh, wow.
Yeah.
So it's very extreme. Again, I think I am not the best to speak, but our practice, at least psychiatry and mental health, is extremely behind in a lot of aspects, a lot. And I think COVID has opened a lot of, our eyes when it comes to that. Está bien, pero sí. So you could definitely develop a disorder, but it just depends on the time. Yeah. I don't know. I hope I'm not sounding political.
But
I wanted to put this
You're
out
excellent,
there.
B.
This is. We don't have anybody Caucasian.
It
Is that the right way?
It don't matter. B.
Okay,
Do
so
your presentation.
sorry, not to say Facts are facts. So
be speak.
exactly. I'm sorry. I don't want. I'm trying to be. Sorry. Okay. But
Girl, this is an open space. Like, don't mess up your mental health trying to walk on eggshells. We're in an open space. We all chose to be here, so do your presentation.
it's so sad. So our Hispanic. I wanted to put this just because it touches home, right? Hispanic and Latinos compose a certain percentage, ¿verdad, of the United States, and of those, only 16%, right, report they have a mental illness. That is over 10 million, right? Which is a lot of people. We think it's a lot, but it's not compared to the percentage that makes up the United States. Why is that? And I'm going to talk to you. I want to jump to the other side, and then I'll talk to you about it. What is more concerning is this one. So the African American compose 13% out of those that combine is the same 16%. That is over 7 million. So we Hispanics have a huge stigma with mental health, huge, and not even female Hispanics. That's even more. But you guys are beating us. With the stigma, you guys don't get mental health care.
No.
Oh no, not
That's
white
not
people.
cultural.
No,
Yeah,
that's
right.
cultural.
Pero we haven't done anything.
Right, I know, right.
Pero
Pray it
you
away.
you guys
You're
don't.
right.
Right,
That's
because that was showing
It go away. That's how they
sometimes it's
No
No judgment, pero it's fine.
That's
Right.
true, right.
Yeah, you're right. That's
ain't that wrong with you. I'm just saying.
That's a yes. That a lot, B.
Pero
Ain't no nothing wrong. You all right.
It's like
Self-medicated.
they laugh at you. I
With
guess
alcohol
say
and
you
drugs.
crazy or something.
Pero it's like it's not talked about at home. Like
No.
what is it?
No.
But because with us it's the same thing. It's like Why are you crying about that? It's stupid.
Yeah.
That sort of thing. Or if not, don't take pills, don't see a therapist. You're not loca, tú no estás loca, don't do that.
Right.
Pero this one scared me. And then I kept looking. I was looking, doing the presentation last week. I'm like, coño, is that, first of all, there's not a lot.
Go ahead, B.
Okay, so there's not a lot of blacks, African American being therapists and physician.
Yeah.
But that just goes into the whole system, ¿verdad? How can you become a physician when we have certain struggles? The same thing with us. I went to medical school in Puerto Rico because it was free. If not, I couldn't do it.
Y'all medical school free?
Public, yeah. But you have to have good grade, and I studied. And then
Don't forget no grade.
and then after that, if you had like books and stuff, you have to. That's why I worked to pay for that. ¿Verdad? While I was in, I worked and studied to do that. But here, it's not accessible.
I think a lot of times with African Americans, I'm sorry to interrupt you, but we kind of go to the church too.
Yeah, that's what Delini was saying. They say just pray about it.
Yeah.
Yeah, exactly.
I mean, I believe in prayer, but I believe in therapy too.
That part.
Therapy and
God wants you to do your part.
right.
Put people in your lives for a reason.
Right.
And it's because the family.
I believe it's sitting on that couch.
No, because with us, it's family. It's the family is like our main source of talking about mental health.
Right.
Or like, and then you're not gonna go to a friend. Most of, at least in my culture, it's more like family. And then it's very frowned upon. For example, when I told my parents I wanted to do psychiatry, they were like, "What? You're crazy, never!" Like all this judgment because I wanted to do it. Hi, Bella.
That's it right there, Julie.
Right.
They judge you like to become a doctor.
So anyway, continuing. So this is like more women mental health. Está bien? So I included this one just because quick image, but there's a bunch of discrepancy obviously when it comes to having mental illness in females versus male. I think there's a little bit of bias when it comes to the same thing when just talking Hispanics and black women not reporting on mental health. I think that has to do with men too, not wanting to talk about their own mental health. So it is more prominent in females. Obviously the hormonal changes like we said is a big. ¿Está bien? Mis amores, these are the two slides that I kind of want you to memorize, like I tell to my students. Porque the warning signs is what you're gonna see in yourself, okay? If we're getting to that place of mental illness, or we might see in others, okay? Like I'm gonna put you in the spotlight, Cuida. But I was gonna reach out because I hadn't seen you in a while, right? To me, that's a warning sign. Cuida's not coming to class. What's happening? ¿Está bien? Same thing with you. I called you out, but it's like just things to be aware of, okay? Very important, all of these ones except these two lead to depression, okay? So we learned this, and I want to share it with you guys in medical school, a mnemonic called ZIG-E-CAPS, okay? Sleep, interest, guilt, energy, concentration, appetite, psychomotor retardation, and suicidal. So that's what you diagnose depression with, ¿está bien?
Wow.
So changes in all of those aspects. So that's big ones, those that are in the top, okay? Then severe anxiety, panic, or fear. Everyone experiences anxiety different. I hate that we want to categorize it into something. Anxiety could be physical, could be emotional, could be even spiritual. So it's more, at least I practice more like tell me how does your anxiety, what is anxiety to you, what is panic to you, what is fear to you. So that is more vague, ¿verdad? But anxiety is different for everybody.
What's considered severe, like in your field?
In the diagnosis would be, I want to tell you the criteria now. Excessive worrying, okay, distractibility, irritability, muscle tension, and altered sleep.
We all like, wait a minute.
I check out everything on the face.
Everybody's like, wait a minute.
Hey, you gotta
I might have to see you on Monday. We check, we got
Hey, look, we gotta hang out at Club Fit. Right. We gotta have bottle service and everything.
Again, being an illness is because it affected our function. That all those symptoms are not letting me work, are not letting me interact with others, are affecting even how I treat my children, how I treat my family, that sort of thing. If it's not there, we're still at the beginning in that spectrum that I explained to you guys. So we're not in the mental illness. You don't have to see me yet. When that starts
We
happening.
ain't got there yet.
Need to see a counselor though.
polarizing
But we ain't got there
aspect to this, like an opposite. So, like instead of having low energy, you're I don't know, it's like you're putting your energy in other places, or maybe instead of losing interest in hobbies, you go all in on something. Like is there
What would that be? called? What would that be called? If it's a complete opposite of depression? Sorry. Mania. Mental illness. It's called manic. Like mania. Bipolar. So I was like, I'm sorry, I'm treating you like a student.
I've heard of manic, but I didn't know what that.
So manic
Oh, like
would
the manic
be,
depression?
because a lot of people say, you're bipolar. You're bipolar. That's, I hate when people do that, so don't do that. But mania, being manic, would be having increased energy, having multiple hobbies, feeling like you're on top of the world, you're gonna be Donald Trump in a couple of months.
No, I'm sorry.
Spending a lot of time
did
with
not know
others,
this.
spending a
That's
lot
what
of
I'm saying, me
money,
neither.
going out a lot, and then the sleep being affected, but in complete opposite. Not sleeping at all and having energy. So that would be me. That's very rare. Very rare. And then and more would be also concentrated, like I told you guys earlier, irritated or angry. Racing thoughts is more kind of like that manic, hypomanic sort of thing, which is just thinking about multiple things. That could also be anxiety if I'm particularly worrying about them. Then hearing, voicing, seeing image, that's psychosis, like psychotic, schizophrenia, hearing and seeing things that are not there. Then some paranoid delusions, but I think that people are out to get me, no one likes me, the Karen syndrome, sorry. And then wanting to harm yourself or harm others.
Okay,
Those are all warning signs, sorry. So, bottom line, these warning signs that I told you guys, the longer they are, the more serious they're gonna be, and then the greater chance we're gonna have to see either a counselor or a psychiatrist. Having a
So the
professional.
sooner it's detected, the better.
See.
And the counselor is the one that's gonna tell somebody that they need a psychiatrist.
Not necessarily. I mean, usually insurances need that referral. ¿Está bien? But if you actually start feeling, to me, bottom line, if you're suicidal or someone you know is suicidal, very likely psychiatrist. ¿Está bien? That's kind of like, I think what pushes major depressive disorder or depression from mild and moderate to just automatic severe.
So y'all don't have, I can't think of what it's called because I want to, where you kind of have to have a referral to come to you.
Not necessarily.
Oh, okay.
I think some psychiatrists do it because they don't want to see the patients and they can filter who they see, but absolutely not. You have the right to just go directly. ¿Está bien? Especially, for example, I get kiddos like for school we need a diagnosis or whatever, so absolutely, you can. ¿Está bien? So most common, I know we talked about them already, but like I just wanted to wrap it up with most common that we see, and I put them in the order that we actually see them in African American and Hispanics. ¿Está bien? Very similar to Caucasian, but in Caucasian this would be higher.
Oh, yeah.
Okay. ¿Está bien? And then this one changes with us Hispanics. Schizophrenia goes there and ADHD goes down. ¿Está bien? That's the only difference. But at least the first three is more common in us. I mean, in our culture, which is mood disorders, anything that changes your mood high or low, which is depression, bipolar disorder, any anxiety disorders. That's super big. That's panic attacks, OCD, like any fidgeting sort of behavior. I can't picture the name, but any generalized anxiety disorder, any type of anxiety disorder. Then substance use that you guys know, right? We call it alcohol use disorder, marijuana use disorder, cocaine, all that stuff. And then ADHD, eating disorders, anorexia, bulimia, and then schizophrenia. Okay? So, how can we care about our mental health? You basically have everything here. ¿Está because I'm promoting the business.
Right.
I'm reading the words. I didn't even
That's why I laughed.
At least Christina does, and Sylvia and all the teachers, and all the instructors, all of you guys do a very good job of pushing us to have good nutrition, exercise. I know we do some meditation when we're doing that breathing and thinking, and we like,
Oh, we are? Okay.
adequate sleep, because if you are doing regular exercise, you're gonna sleep a little bit better.
Yeah.
Learning to control stress, because whenever Akila and I are screaming, we need to control stress. The support system that we have here with all of us. And then obviously you got someone you can talk to, professional help. Okay. So,
They do help with stress.
I wanted to, this is, I know, I kind of was back and forth, I'm like, if you have time, I want to talk about it, but I am a true believer of eliminating the stigma with mental health, and I try to do it anywhere I can, so I'm taking this platform to do it. So let's just talk more about it. Listen to people who have mental illness. Let's watch our languages, right? Like, not say like, oh my God, I'll kill myself if that happens to me. Oh my God, you're so bipolar today. Oh my God, you're depressed. No, so that language is extremely stigmatized. We don't want to tell you. And then obviously just have the conversation. Okay? So I want to start off with kind of like throwing some myths and just see if you guys think they're real, they're not real. What are your thoughts? People should work out their own mental illness. Just work it out. Basically, that's what I was trying to say. Is this true? Is it not? What do you feel about it?
What do you mean by working out?
I don't know if I got the correct way. I don't know. Like, work it out.
I mean, like, people should, I don't know.
But if you can't work it out on your own, then you need to know that
I'm recording it, right?
Basically, like, work it out more of like
They say
what
it's
you were
kinda
saying. Like,
hard
I
to
just
do.
work it out on your own. So,
But I don't have the rest of it.
So, right, the stigma is like, of course you can do something on your own, like that self-care assessment, but when it reaches a point that we have that in the spectrum, that mental illness, we reach out to others. And please, we have the perfect group here, like Christina and Sylvia and Rita and all the instructors are super open for us. I know if I'm having a bad day, I can talk to you. I had a rough day today, my fiance is acting ridiculous, like I can talk about all of that. And I think we should take advantage of that. ¿Está bien? Okay, the other one. Once you have a mental illness, you have it for life. That was very quick.
Because I don't believe that.
Once you have a mental illness, you have it for life.
That's a myth.
I'm asking.
I
do know somebody that-
I think it does become part of you.
What?
Yeah.
Because you accept it.
Okay.
But that's in your mind though. That doesn't mean that it has to be with you for the rest. Like for the rest of your life. No, like if I'm depressed because I went through
100%.
depression. I went through it real bad when I went through my divorce and the first time because it was very abusive. All of that. I went through horrible depression. Had to take medication. I'm not depressed no more, and I don't feel like that runs in my family. I feel like I went through something at that time in my life, and it affected me, and I didn't know how to deal with it, and I developed that illness for a while. But I don't feel like that's me.
Correct.
What's the one that they be seeing? They be hearing voices and stuff. That's
Schizophrenia.
Oh, you talking about schizophrenia? You're like, I believe that's
That's
No,
right.
because I know somebody that's like that. They like they 60 though. But they ain't on their medication.
Well, you said it. You said it.
You better clear them up.
Exactly. That's what I was trying to
You
say.
said the part about not taking
Because if
medication.
they take their medicine, it's.
I got you. Okay.
So what it is like, of course you might have it all your life, like that's severe, right? Like schizophrenia, and people who are alcoholics, like I'm gonna have it for life. That's it. But when it comes to depression, anxiety, most of them can be treated with medication for that period of time.
Okay.
Relapse.
So are there some you're saying? So what is it? I'm like, so
The
what?
chemical imbalance is the one
that you're
Very
saying-
likely the genetics. Very
Okay.
likely the genetics.
Oh, they be
Okay.
The
Okay.
genetic ones. Usually schizophrenia is very genetic.
Okay.
Bipolar disorder it is too. And then major depressive disorder, like we call it treatment resistant, right? Like someone who has been in and out of hospitals, been in and out of psychiatric care because they tried multiple times. That's usually genetics. And that might be for life. Like that's a patient that even though they're feeling better, I would tell them, don't get out of the antidepressant, keep taking it, but they're not experiencing. In her case, it could have been, sorry to use you, but it could have been an adjustment period, right, when that happened. Some grief there too, trauma, and so you name it. And then all of that accumulates, and that's why we have the depression. But after you start reviewing stressors, there's no genetics, there's no, so it's different. But absolutely, there's some that are for life, but with medicine, they're very functional. Okay?
Yeah, they gotta stay on that video.
Then this is the last one. Okay. Is mental illness a sign of weakness?
No.
No. Yeah.
I was very that was one of the big ones. If someone said yes, hello. Okay. And then
Education, boo.
In
So,
our culture,
wrapping it up, some research now, which is super cool, that the last 7 months, I think, 7 months, we've had basically a 911 for mental health, which is 918.
I just
It's
learned about that.
amazing. The calls that have been made have been incredible. And the waiting time is like 16 to 32 seconds. It's like that, very fast. And then I wanted to include this because I know we see a lot of women, not sure if you know about this, Cristina, but or Sylvia, like, because this one, just in case we get that, I don't know, friend here who comes to the studio. So the peer support respite, it's basically they have it in different counties, and it's places some women, men can just go. Most of the time it's females, right? Some of them are for males, but most of them are for females who can go if they're having trauma at home or having a hard time at home. They can go and they can stay up to 8 days, which is good. They have some food, they have some people volunteer. That's a good place to volunteer if you wanted to. Like even provide some money or I sponsor them because if they do very good work. This one,
The link? Okay.
Porque they also do a peer-to-peer support group, so anyone can get a peer support certificate. I think it's like an exam in 3 months of doing some PowerPoints. I did it, it's super easy. And then you just sit down and you can peer-to-peer and guide do a group, it's super cool. And then,
So what happens after the 8 days?
they
Just out
have
of
one
curiosity.
social, that's the sad part, thank you. Oye, Cristina. Pessimistic, I was so excited. So anyway, the reality, they have one social worker there, and she tries to handle most of it. So they either have to go back or the
So
social
they
worker
come
can-
for 8 days and they possibly have to go back to the place where they're experiencing trauma or whatever.
Yep.
That's
Yeah.
horrible.
I know. But at least they have 8 days.
So they need more social workers.
Correct. And help, resources. And the population most of the time there is African American and Hispanics. So I sometimes volunteer there to Sabe, even if it's like paperwork stuff.
Okay.
Because they do very good work. And they are in different counties. I learned that just as soon as I moved here because I was sending, some adolescents there. But they have in different counties they have their own too. And you can go, I do sometimes free, therapy stuff. So it's a very good program.
Okay.
And some of it is government funded, not all of it. Some of it's just like people like Nalini and myself, that just give to them. But it's a very good resource to have. The NAMI one is more like a national mental alliance, which is they do a lot of 5Ks and stuff, but that is national. That is the one that I would. And then psychotherapy included just super quick ones. This our online therapy, Better Health, Talkspace, and then Psychology Today. I kind of want you guys to circle this. Porque you can find psychiatrists and psychotherapy, and you can actually filter if they take your insurance or not, if they do sliding scale or not, if they do sponsoring. So if you filter through all those, you can have people in your area, like I don't know, Hispanic, female, all that stuff, and then they would narrow it down to people around your area. Okay.
There's also therapy for Black girls.
Yeah.
I didn't even know
That's
that.
the one. That's the one I'll be
Black
calling.
girls are. Is it that
That's the
one?
one you've been calling.
Is it?
I found like a lot of them on there. That's the ranks that I got from them. The Better Health was the one that I went through with the system. They have a system. So that's the one that puts you in the box. So you go off a grade scale for the Better Health. So that's the one I went on. And the Black girls was the ones with the 150, 125. So those are the ones that I.
Try the
But you gotta call back and ask what sliding
Like,
scale.
Sí. And in psychology, you can put even like, if you want, I don't know, PhD, else, everything. It's like, at least you can filter it down. Like, I remember filtering down the first time I moved here and it appeared nothing. There was no Hispanic, like how I wanted, which is sad, but some of them do tell me. So I'm seeing someone actually from Miami who does my therapy, but anyway, so it was through Psychology Today. And then they have a very strict process to who they approve. So I don't know, I think it's a good resource to have. Anyway, and then that's it. Questions, we're done. No? Okay, great.
You're so
Beautiful. Next.